Hi there, it's Dr. Atkinson, and in this session, we're diving into upper respiratory tract disorders with a focused look at rhinitis, one of the most common conditions you'll see across all care settings. Understanding the upper respiratory tract. Let's start with a basic overview. The upper respiratory tract includes the nose, sinuses, pharynx, larynx, trachea, and bronchi. Disorders in this area range from mild nuisances, like the common cold, to serious life-threatening illnesses that may require permanent changes in how a person breathes or even speaks. As nurses, we need solid assessment skills, knowledge of different upper airway conditions, and a strong grasp on how these disorders affect daily life. Education is a key part of our role, especially since many of these conditions are managed outside the hospital, either at home or in outpatient settings. But when someone's condition is acute or severe, your clinical judgment becomes essential, and you'll also need to help them think about long-term rehab or lifestyle adjustments. Upper airway infections, URIs. The most common upper airway issue? Infections, often called URIs, upper respiratory infections. These affect almost everyone at some point and include both acute illnesses that last a few days and chronic cases that can drag on for weeks. URIs involve the mucous membranes of the nose, sinuses, pharynx, upper trachea, and larynx. Most are caused by viruses, but bacteria can also be involved. Adults typically get 2 to 4 URIs per year. No surprise if you've ever worked in a clinic during flu season. The common cold is the prime example of a URI. Though they rarely lead to hospitalization, URIs are the #1 reason people miss school or work and are a big chunk of outpatient visits. Nurses, especially those in the community or long-term care, play a critical role in symptom recognition, prevention education, and early intervention. Special considerations in older adults. Now, older adults are a special group when it comes to URIs. A few key points. Influenza can seriously worsen conditions like COPD. Decongestants and antihistamines must be used with caution due to side effects and drug interactions. Non-allergic rhinosinusitis is more common in this population, and sinus surgery demand is expected to rise as our population ages. Anatomically, aging affects the nose. It lengthens, the tip droops, and airflow becomes restricted. GERD-related laryngitis is common in older adults, so elevating the head of the bed and using acid reducers like famotidine or omeprazole can help. Lastly, the voice changes. It thins out, pitch shifts, and can sound tremulous. It's important to distinguish these normal changes from something pathologic. Let's talk about rhinitis. Rhinitis is not just a runny nose. It's a whole group of disorders involving inflammation and irritation of the nasal mucosa. It affects up to 30% of the population worldwide and can severely impact quality of life. There are a few flavors of rhinitis: acute or chronic, allergic or non-allergic, and allergic rhinitis can be seasonal, like spring pollen, or perennial, year-round triggers like dust or pets. Rhinitis often shows up alongside asthma, sinus problems, or ear issues, and can even affect sleep and learning in children. What causes rhinitis? Environmental triggers like cold air or humidity changes, odors, infections, medications, and even foreign bodies. Allergens like pollen, dust mites, animal dander, certain foods, or medications. Viral infections, especially the common cold, are a major culprit. Drug-induced rhinitis is real too. It can show up with medications like ACE inhibitors, beta blockers, statins, antidepressants, and aspirin. Signs and symptoms. The clinical picture includes rhinorrhea, a fancy word for a runny nose, congestion, sneezing, nasal discharge, which can be purulent if there's a bacterial infection, itching in the nose, throat, eyes, or ears, possibly headache, especially if sinus involvement is present. Non-allergic rhinitis can happen at any time of year. Let's break down the triggers. Indoor allergens include dust mite droppings, pet dander, cockroach particles, indoor molds. Outdoor allergens include tree pollens like oak, birch, cedar, weeds like ragweed, sagebrush, grasses like timothy, Bermuda, outdoor molds like Cladosporium, aspergillus. Causes of rhinosinusitis table overview. Rhinosinusitis has many possible causes. Here are the big categories. Vasomotor, caused by triggers like perfume or emotions. Mechanical, issues like deviated septum or nasal polyps. Chronic inflammatory, from conditions like cystic fibrosis or sarcoidosis. Infectious, viral or bacterial sinus infections. Hormonal, changes during pregnancy or hypothyroidism. Management starts with a solid history and physical exam. Ask about environmental exposures, recent illnesses, and medication use. If it's viral, you'll manage symptoms, no antibiotics. If it's allergic, you may need allergy testing, immunotherapy, or corticosteroids. If it's bacterial, treat with appropriate antibiotics. Structural issues like a deviated septum, that's an ENT referral. As for medications, antihistamines are your go-to for sneezing, itching, and runny nose. Combo drugs like brompheniramine, pseudoephedrine help with congestion. Cromolyn prevents histamine release. Saline sprays loosen mucus. Ipratropium nasal spray is great for persistent runny nose. For severe congestion, use intranasal corticosteroids. For eye symptoms, try ophthalmic cromolyn. Leukotriene modifiers like montelukast and IgE blockers like omalizumab are options when allergy and asthma overlap. The choice of meds depends on your patient's symptoms, allergies, ability to follow the plan, drug interactions, and cost. Nursing management and patient education. Your nursing role here is education-heavy. Teach patients to avoid allergens like smoke, pets, strong odors, and dust. Go over how to use nasal sprays correctly. Blow the nose first. Keep the head upright. Spray away from the septum. Wait 1 minute between sprays. Clean the nozzle after each use and no sharing. For patients with infectious rhinitis, reinforce good hand hygiene, especially around babies, older adults, or immunocompromised patients. Encourage annual flu vaccines, particularly for high-risk groups. That wraps our overview of upper airway disorders and rhinitis. Remember, what looks like just a cold can have a big ripple effect, especially in vulnerable populations.